Why do nurses need to be concerned about stress? Well, we're going to learn. This is Chapter 38, Stress and Coping. Make sure that as you go along and watch these lecture videos that you either write down your questions or even email them to me and I will answer them. And also, just like with the other chapters, I mentioned when you email, make sure you say that I'm allowed to share with the class without using your name, or that you want a private response. The reason is I think that when you guys have questions, maybe a lot of people have those same questions, and if we share it, then it helps everybody. But just let me know. So patients experience stress. Long-term stress can even have very negative health effects. Nurses, though, we also experience stress, so this may be helpful for us as well, this chapter. Nurses need to know how to help patients recognize how they cope in stress and learn effective coping skills. What can cause stress? Well, your book will tell you a shark coming toward you, health problems, financial difficulties can all cause stress. And our body reacts the exact same way, whether it's the shark or a fight with your boss. Your textbook talks about the general adaptation syndrome as a reaction to stress. Make sure that you review this. This slide details our fight or flight response. This is also in your text, and it tells you exactly what's happening during that fight or flight response. We have increased mental activity, our pupils dilate, we have bronchiolar dilation, increased respiratory rate, etc. Stress can be acute or chronic. Time-limited events that threaten a person for a relatively brief period provoke acute stress. Living with a long-term illness produces chronic stress. Post-traumatic stress disorder begins when a person experiences or witnesses a traumatic event. Anxiety associated with PTSD can lead to nightmares, flashbacks, depression, or emotional detachment. Causes of PTSD include motor vehicle crashes, military combat, rape, or even natural disasters. A crisis occurs when previous ways of coping with stress are no longer effective. Developmental crisis, caused by a new stage in life that requires new coping styles like marriage, divorce, adolescence, moving away from home. Situational would be caused by external sources such as the loss of a job or hospitalization. Don't forget disaster. When you talk about disasters, well, in our environment, we can think about hurricanes. Coping is the person's cognitive and behavioral efforts to manage a stressor. No single coping strategy works for everyone or for every stressor. In a stressful situation, most people use a combination of problem and emotion-focused coping strategies. Defense mechanisms help a person cope with stress indirectly and offer psychological protection from a stressful event. So people use them unconsciously to deal with stress. Make sure that you go to page 774. There's a box there that's labeled 38-1, which gives you examples of ego defense mechanisms. Ask open-ended questions when we're talking about assessment. Subjective findings include the patient's view of the stress, ways of coping, and possible maladaptive coping, and compliance with prescribed medical recommendations such as medication or diet. Again, I have a reference for you guys. Go to page 777. That box 38.4 is an excellent source on what nursing questions we may ask during the assessment phase. Nursing diagnosis for people experiencing stress generally focus on coping. Specifically, major defining characteristics of ineffective coping include verbalization of an inability to cope and an inability to ask for help. Three primary modes of intervention for stress are to decrease stress-producing situations, increase resistance to stress, and learn skills that reduce the physiological response to stress. Educate patients and families about the importance of health promotion. A regular exercise program improves muscle tone and posture. It controls weight, reduces tension, and promotes relaxation. In addition, exercise reduces the risk for cardiovascular disease and improves cardiopulmonary function. Patients and family members who are well rested are better able to manage stress, problem solve, and maintain a sense of control over the situation. Support systems include referrals to community resources such as the American Cancer Society or Multiple Sclerosis Society. Time management techniques include setting priorities and identifying tasks that can be delegated. Guided imagery, visualization, and relaxation, earlier discussed as a non-pharm methods of pain management, can help with our patients' stress as well. Assertiveness includes skills for helping individuals communicate effectively regarding their needs and desires. For many people, keeping a private personal journal provides a therapeutic outlet for their stress. Mindfulness-based stress reduction involves meditation and yoga. Burnout occurs as a result of chronic stress in the workplace. In nursing, burnout frequently results from intense caregiving and manifests as emotional exhaustion, loss of a sense of personal identity, and feelings of failure. Making a clear separation between work and home life is crucial. When stress overwhelms a person's usual coping mechanism, it becomes a crisis. The precipitating event usually occurs approximately 1 to 2 weeks before the individual seeks help, but sometimes it has occurred within the past 24 hours. Crisis intervention is a specific type of brief psychotherapy and has two specific goals. First, patient safety. Use external controls to protect the patient and others if the patient is suicidal or homicidal. Second, it focuses on the specific problem that caused the crisis. New coping mechanisms may be necessary. The goal is to return to a pre-crisis level of functioning. A patient recovering from acute stress often spontaneously reports feeling better when the stressor is gone. Ask patients to compare current feelings and behaviors with feelings and behaviors 6 months ago. If desired outcomes have been met, the patient reports feeling better now than 6 months ago. Recovery from chronic stress occurs more gradually as the patient emerges from the strain. In either situation, reassess the patient for the presence of new or recurring stress-related symptoms. An essential part of the evaluation process is collaborating with patients to determine if their own expectations from nursing have been met. Any revision in the plan of care includes steps to address patient expectations.